Hello, everyone, and thank you for tuning in to the Mindful Professional Podcast. I'm your host, Dr. 𝗶𝗶𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀 highlight the incredible professionals in our local community and learn how they balance and stay mindful while doing big things. Today, our guest is someone who truly meets people where they are. Heather Suri is a nurse and a certified care manager who transitioned from the traditional hospital system to start her own private practice. She fills in the gaps where the healthcare system often misses. She essentially everything from transportation to legal and financial navigation. Welcome, Heather.
All right. So, I started the podcasts, I would say maybe like 3 or so months ago, late fall last year, essentially. And, I've been in the mindfulness space for the last couple of years. And I've always been curious as to how other professionals handle is this work-life balance a real thing, or it's a myth? And so it's like, I would love to talk to other professionals locally, and this would help me like highlight what you're doing, as at the same time kind of pick on you a little bit and see how you have, how you creating that balance and being mindful of what you do at work. And sometimes the biggest thing is like leaving work at work when you come back home too, right? I'm so glad you're able to join and talk to me about what you do.
Yeah, thank you. I'm excited to talk about it too. It's a certainly for those of us in healthcare spaces and caring spaces, the work-life balance piece could be really challenging. And then we're trying to model that for the families that we're working with, because family caregivers are also struggling with that balance piece too, with passion.
Yeah. So tell me, how did you get into caring for families? What kind of got you to start your own business? Tell me a little bit more.
Yeah, well, I've been a nurse almost 30 years now, and I always loved working in communities. I did, through my clinical rotations in school, hospital nursing, acute nursing, and I knew at that time that wasn't how I wanted to practice nursing. I really liked to meet people where they are and have the time and the space to practice more holistically. So I was always drawn toward community nursing roles. And then as I continued, working in a lot of different settings, also drawn to working with older adults, working in long-term care, working in home health, working in home care. I also held a credential for hospice and palliative care nursing. So I did that work for a lot of years and loved it. But I found that no matter where I was working as a nurse, I still had a lane. It was a broader lane than what was available to me working in a hospital setting, but it still was a lane. And there were all of these other things I could see happening to families and around families that impacted their ability to age as successfully as they could. So, simple example, somebody's maybe home after a hospitalization or a skilled nursing stay for rehab. And, I'm there to check their blood pressure and make sure they understand their medication. And to make sure they know about this follow-up appointment they have with a medical specialist, but they don't have a way to get there, so they don't go. Right? So then I'm not there to figure out their transportation. I'm the RN, but I know that if somebody doesn't figure out that piece, then we can't get them what they need. And then we're going to end up back in the hospital or something like that if we don't have the right follow-up. So there were a lot of pieces like that I was seeing. And that's how I ended up starting my practice, because working as an aging life care professional just gave me a really wide open space to practice what I believe is just truly person-centered care. Because really in this space, I'm only limited by what the family or the individual defines as what they want and need. And it's my job as an advocate to use all of my skills as a healthcare professional to coordinate and help them meet their own goals for health and for wellness and for aging.
Okay. So your practice, you talked about coordinating services. So tell me more as to, like, comprehensively, what services does your practice provide?
Yeah, and it's very broad. Our professional association, the Aging Life Care Association, acknowledges 8 kind of knowledge bases for care managers. So we're certainly looking at the health and medical. And because I'm a nurse, I do a lot of that. So we're helping people find the right neurologist or a primary care provider that doesn't make them feel quite so rushed. Or maybe we're looking at, do they need home care, home health, hospice, other services related to the kind of health and medical piece. But we're also helping them understand their legal documentation and their estate. And when do you see an estate attorney versus an elder law attorney? And do your documents need to be updated? And who do you need to talk to about that? We're helping them understand the financial landscape of, if they have concerns about how they are going to pay for care as they age. Are there entitlement programs that they might have access to? If so, are there things that we should be doing now to make that easier if and when it's needed? We're looking at working within family systems. A lot of families have conflicts at multiple different levels. So how do we make sure everyone in the family is getting what they need? We often run into, maybe there are 3 adult children and 1 adult child is doing a lot of the heavy lifting with the caregiving, and the other adult, they feel like their siblings aren't helping. And so how do we help get everybody on the same page and kind of get what they need? We're looking at housing. We're looking at professional advocacy. So there's all of these different areas that we help families, and it's very individualized depending on what's happening with that family in the moment, and then might change over time.
Yeah, and that's a lot more than what you've done as an RN for most of your career. So what inspired you to make that shift? I know you saw some gaps on how the treatments was coordinated. Was that what kind of triggered you starting your practice, or was there something else that inspired you to start your practice?
Well, there was actually, it was one kind of specific event. I was working in the home care space, and I was working with a family, with a couple who had care coming into the home. And the gentleman had a stroke. So he was cognitively intact, but had a lot of physical limitations. His wife was ambulatory and physically able, but had cognitive impairment. And we had to figure out a way to care for both of them. So we started by providing care for the gentleman and helping him with showering and bathing and getting to the bathroom. But then we found that overnight, so we put a live-in caregiver there, but the caregiver needed to sleep at night. And he was getting uncomfortable at night. He needed help with repositioning his body and things like that. So then we put in another caregiver who was awake at night to let the live-in caregiver sleep, and to help him with his needs overnight. And then one day, when the live-in caregiver was giving the gentleman a shower, his wife wandered out the front door. So then we had to put a third caregiver in to make sure she was supervised at all times. And this was extraordinarily expensive. They were burning through their financial resources really quickly, but the family just saw all of these needs and was just doing, the best that they could to figure out how to resolve it. So, I knew that this, in this scenario where their care needs were so high and so different, that, a senior living community might be an alternative for them to help control the costs, but still get the level of support that they needed. Now, as a home care nurse working for a home care company, it certainly was not in my job description to educate them about an alternative, which would render the business I was working for no longer relevant. But I had a fantastic boss who understood that I really felt like I had an ethical obligation to educate this family about their options. And so I sat down with the family and said, there might be a better way to do this that will increase the chances of their financial resources, being present for them for the rest of their lives. Yeah. And so we did. We helped them identify a senior living community. We got her moved into a memory care, him moved into assisted living in the same building, so they could be together, but also had, support for their individual needs. And once we got all of that done, the family approached me and said, okay, we don't need home care anymore because, our parents are doing really well in this setting, but we still need you. How much do you charge? And I thought, I don't know. How much do I charge? And so I really, in that moment, felt like I invented the whole profession of aging life care management. And it wasn't until I did some research after that to find there was a professional association and, a whole profession that had been around for decades, doing exactly this, coordinating resources and making sure that families were equipped with high quality information so that they can make informed decisions for themselves.
Yeah. And it's very important, right? And I don't know, how much awareness there is, because we still see majority of the patients I see in my office are older patients. And we see situations like what you're saying, and it's hard to find a balance on kind of, yes, you're here for your hearing care, but I also see that you need assistance with this, or your spouse needs assistance with this, and here's a good referral. So how do people learn about your service, and what triggers them to call for your service?
So we still have a lot of people who call us in a crisis. We wish we could get to people before the crisis, because I think there's a lot of things that we could do to prevent a crisis. But we still get people who call us from the hospital, from a skilled nursing facility, saying, they told me I'm discharging in 3 days and I don't know what we're going to do, and so or in the hospital, sometimes they're telling me I'm discharging tomorrow. And the case manager gave me a list of 5 nursing homes and I got to decide by lunch where to go. And it's very overwhelming. And because of Medicare regulations, and most of the people that we're taking care of are insured under Medicare, the hospital caseworkers can't say, go to this place, not to this place. But we are not bound by those same regulations. So we're able to kind of help guide people and help them know what to expect and how to prepare for that transition. So we still get a lot of people in crises, but increasingly, and this is my 9th year owning this practice, we're getting referrals from neurologists who are treating people for Parkinson's disease and dementia, and know that, they can write a prescription, but there's all of these other things that have to happen in the periphery to help people live well and to support their care partners. Sometimes people find me because maybe they had called a senior living community to want to move in, but they're like, we don't have a power of attorney yet. And, my mom might have a hoarding issue and we need to sell the home in order to get the proceeds to pay for the care. Or my dad has some cognitive changes and he still thinks he can drive and he doesn't want to come into senior living because he thinks he's fine, but we know that he needs help and he's not safe. So they might call me when there's all of these barriers that prevent people from moving forward. And then really, I think increasingly word of mouth, I think for a lot of us that do what I do, once, the work that we do can be so impactful that people talk about it. So
Right.
I get a lot of calls from my neighbor, my friend, my daughter's mother said they use somebody like you. And your home.
Yeah. So how does it work in terms of, like paying for services? Does insurance cover any of this or is it all out of pocket? How does it work?
Yeah, no, and medical insurance doesn't pay for what we do. We certainly have, through our professional association, have advocated for Medicare to consider it because we think that we probably can keep people out of the hospital, which is, Medicare's problem for costs. But yeah, so far, no movement on that. There are some long-term care insurance policies, at least for the generation that's accessing those right now, that sometimes have some coverage for what we do. So that's one of the things that we screen for when we're helping people. I do a lot of, it's become my personal mission to make sure people get the return on their investment for these long-term care insurance policies because they're so expensive. And when people actually need them, it's very overwhelming to get that claim successfully filed. So we like to help people do that. So but sometimes we can get them reimbursement for our services through one of those types of policies. But largely, our services are paid for out of pocket. The way that I address that kind of two ways. One, we try to make our services accessible to as many people as possible. So we do hour-long consultations for kind of a discounted price. So sometimes 3 adult kids, I charge $150 for an hour. So if 3 adult kids can get together and we can help them map out a DIY plan, we can get a lot done in an hour. So we try to do a lot of public speaking on topics that impact, we see the same things kind of coming up again. The driving thing is often comes up. That's a tricky one to navigate. So we try to do some public education to make it more accessible. There are some grant programs around that cover some care management. But I think the real nugget is, again, how do we as care managers bring value for the cost? So back to that original example where, these folks were paying 3 caregivers, 2 to be there simultaneously, was a really expensive way to provide the care, but the family didn't know of another way. So, how can we help people make the right decisions and give them all of the information they need to make the right financial decisions to save money in the long term? If we can get in short term and help people have good planning, then I think a lot of times the cost savings ends up, covering our cost if we can help people with good planning up front.
Yeah. Have you worked with seniors for majority of your career. Were there any surprises when you opened your own practice?
I don't know about surprises. I think that I've always loved working with older adults. There is this honor of being present for this extraordinary accumulation of wisdom and legacy and the stories and the lived experience, that it's just, that has always been such a tremendous joy in working with older adults. I think that, one of the things that sometimes surprises me is how little families talk about aging.
Yeah.
And what's involved in aging. I think I work, so the surprises maybe are less with the older adults and sometimes more with the adult children who just really don't have an understanding of what people need as they age, and they don't have a plan. And so I think that it catches a lot of people off guard. And in this country, we have prolonged frailty in aging. 10 to 15 years, I think, is the average of that. What we consider a frail elder. So we have figured out on the medical side some longevity, but it's not always longevity without disability. And so in those 10 to 15 years of frailty, people need help. And Medicare doesn't pay for home care. They don't treat it as medically necessary, when I would argue it is absolutely medically necessary. It is not a luxury. If you need help getting to the bathroom, I don't consider that a luxury.
Right.
But when Medicare was designed, we didn't have this prolonged frailty. So I think that so if there is a surprise, I think a lot of people still think that their Medicare, their health insurance, is going to pay for in-home care, or is going to pay for them to be in assisted living. And it does not. And that comes as a huge shock, that and the costs of care, which continue to rise. Huge stressor.
So what are some early signs that caregivers' children would start, where they start thinking about your services and try to coordinate? Because you said a lot of people call you in crisis mode, but you would like to have them call before. So what are some signs that you would say, hey, when this happens, then you should start looking? Or is it a certain age mark, when they hit a certain age, then you say you want to start looking at all the care options?
Yeah. So I think it has less to do with age. And what I really wish families would do would talk about these uncomfortable things early on. And, they need to talk about money. Nobody wants to talk about money. And they need to talk about the advanced care planning pieces, what you do and don't want as you age, those value pieces of what's important to you, because people might make different medical decisions on their journey if there was more clarity and conversation in the family about what they do and do not want for their medical care as they age. So I wish those conversations were happening earlier. But I think adult kids need to have these conversations with their parents about what the financial plan is. Who are the backup decision makers? Because it's always in a crisis that kids are in the home going through the file cabinets trying to find who those. And I wish every adult kid who knew they were a backup power of attorney had a PDF ready to go to send to the hospital or to use, because it's a lot of time and stress in a crisis to try to identify those documents.
Yeah.
But I think it's with retirement, there needs to be some conversation about, not one conversation, but smaller conversations over time.
Yeah. Now, you talked about the adult children. They are kind of in that tricky age where now they're caring for their parents and they're caring for their children. What have you seen how has that impacted, the family dynamics in that type of a situation?
So that's the sandwich generation, right? Part of that sandwich generation. So I think families are handling it different ways. I think we're starting to see more families consider, intergenerational households,
Sure.
which certainly is, one way to address the problem. Though I think it's adult children need to be really aware of what that entails, because sometimes it's a great way to solve the problem, and sometimes it's not, because when people need care are the adult children who might be in the workforce or might not be comfortable performing that personal care. So that still means hiring someone to come in and do that, and that may or may not be the right solution over time. So I think having those conversations about and also about relationships, and I do a lot of conversations and coaching with adult children, but also with spouses who are providing care, about their personal boundaries, and how do we make sure that the adult child or the caregiving spouse doesn't become depleted, because then we have two patients instead of one, So, and that looks a little bit different for everyone. Sometimes parents have the expectation that the adult child will care for them. Sometimes the child is willing, but especially in American culture, the elders don't want their adult children actually providing the care. There's this sense of independence, and they want to be distanced from it. So it's a lot of navigating family dynamics, and it looks a little bit different for every family. I'm referencing the cultural pieces because I am married into a Pakistani family that, in Eastern cultures, aging and the way families handle aging is different. And certainly in as diverse an area as Northern Virginia, we have a lot of different families with a lot of different cultural backgrounds, but they're all trying to solve the same problems of people in the workforce, and the way the healthcare system is structured and the way the care system is structured. Those barriers are the same, but the way families navigate them, it can be heavily influenced by their family.
So you mentioned setting boundaries. What is your recommendation or some advice that you would give for adult kids or spouses that are caring for their loved ones?
Yeah. Well, there's, that old adage that they tell you when you're on the airplane. The flight attendants will tell you put your own oxygen mask on first, and then you help the person next to you. I think that continues to be true, because if as a family member or a care partner, we don't have the bandwidth to keep ourselves well and healthy, then we're pouring from an empty cup, and then our help, can sometimes not be as helpful. I really try to coach caregiving family members around, the role as advocate. So family members, if it's a spouse or an adult child, they I tell them you're the person who knows your person the best, who loves them the most, who knows the most about what they do and don't want, and about their values. So you have to protect your ability to do that, which means you have to take excellent care of yourself. You need to eat and sleep and go to your own medical appointments and do what you need to do, because what taking care of ourselves looks like is a little different for everyone.
Right.
So do what you need to do to take excellent care of yourself, to to be able to function as an advocate. And anything more you can do that you have bandwidth for, that's great. But that's the most important thing to protect. And sometimes it's providing permission. I think this is something that, though I work with a lot of adult sons who are working very hard to be wonderful caregivers, we live in the world we live in, and it's a lot of women who are carrying heavy loads, whether it's spouses or it's daughters, and they're carrying the loads for parents and also for their own household.
Yeah.
And there is still a societal expectation that women give and give and give and give to their own detriment, So I think that it's and I think it's very difficult to navigate, because it's where is my boundary supposed to be? Am I being selfish if I need, more rest or more time? So there's all of this judgment that's associated with it. And, especially in American culture where we value independence so much, people are doing this in isolation. So they don't have, family caregivers don't have the community support to talk about this experience and what it's like for them, and to get that emotional support from a community about their role and how to support their person and also take care of themselves.
Are there support groups for caregivers?
There are. I mean, you have to look for them. Like everything, in our care system for older adults, things are very fragmented. That's something that aging life care professionals see a lot. And part of our value is that we can kind of make sense of it, weave it all together. But, there's lots of caregiving support groups. Social media, is a good way to find things. Certainly, there's support groups that can be kind of disease specific, like for caregivers working with somebody with dementia, or caregivers working with someone with Parkinson's. My practice offers a support group for anyone who identifies as a caregiver, and we do it virtually twice a month.
Nice.
And that's run by one of our care managers. So there's, there are a lot of things out there. It's just a matter of finding the group that feels right, and whether you want to be in person or online. But and it's tremendously helpful. And I love support groups for solving a lot of the practical day-to-day problems, because, we can't all just hire care to solve every problem, right? And some of the greatest barriers for families are these little day-to-day frustrations. And sometimes some of the best, easiest, and least expensive fixes come from somebody else who has been through it and says, this is how I did it. So I think I almost see it like business networking. You got to find other caregivers out in the wild, and connect together to support each other and to help each other.
Right. So you mentioned, caregivers sometimes feel like being selfish, trying to take time for themselves. So what role do you think self-awareness or mindfulness plays in preventing burnout?
Oh, it's critical. It's the most important piece. You have to fill your cup first and make space for that. And I have 4 children, and I have a husband, and I have aging parents, and I helped support, a grandmother through the end of her life with dementia. Plus, I have employees who do this kind of compassionate work, and I have clients. So I have, I personally have to be very intentional about protecting my time and my self-awareness and practicing mindfulness, because it is very easy to overextend myself. And so it's, putting, for me, putting, you could call it boundaries, or it's structure into place that carves out time for me to do that. And it's interesting because I actually feel like I started to get more intentional about my own self-care when my practice started growing, and I got employees that I would see, why are they doing, why am I getting emails and charting from them at 10 or 11 at night? Like they're having trouble turning off. And then that made me think, okay, am I sending emails at 10 o'clock at night? Like, how am I modeling, and anyway, that kind of helped me kind of be better about my own boundaries. And we spend a lot of time with our team talking about how to take excellent care of themselves so that they can support all these families.
Yeah. So what is one personal ritual, mindfulness ritual you use to be able to turn off work when you go home and care for your family?
So, I put it on my calendar. Actually, I use my calendar for a lot of things. So I put it on my calendar when, my day is done, and I build in some buffer time there. And then, my personal kind of practice is, I call it the second shift. So, after I leave my job, I go home and it's homework with kids, and it's making dinner. My parents raised me, and, my husband and my family, we do home cooking. We eat out very little. And I do feel like the ritual in some of that, slow food cooking and modeling that for my kids and protecting that family time is something that I'm careful about doing. And then, I think that also making time, meditation has been very helpful for me. It was very difficult to get started because I'm a type A person, and it was physically uncomfortable to try to get my brain to stop. I did not like it at all when I started it, but I also, because I'm a type A person, I had read all of these studies, there's all of this science backing, how important it is, what a critical tool it is. And so I'm like, I can't ignore the science. So I really, and everything said it's practice. I like to be good at things on the first try. That's another thing for me. And I was not good at meditation on the first try. But that practice has been really helpful for me with resilience and with managing stress.
One of the things that, that's something similar I've struggled with. And one of the things that have helped is, one of my teachers was like, the purpose of meditation is not to calm down. You don't have any goal to achieve, nothing. You don't have to feel a certain way. Don't set goals that at the end of meditation, this is how I want to feel. Meditation is just being present, and there's no goal. If thoughts arise, you're watching your thoughts, and you're just kind of coming back to your practice. And that really helped, where I was like, okay, then there's nothing really that I'm chasing. And, if thoughts go, it's okay. And it's okay to be kind and acknowledge it, and then bring your mind back to just focusing on your breath. And that initially, like you, it was very uncomfortable to sit in one place. I'm the kind of person that is always on the move, and to get me to sit in one place and meditate was what, yeah. And like you, when I introduced mindfulness to my team, and we were talking about self-care and not burning out, I was like, it's not just where I'm coming from that I'm telling you all this, but it's also science backed. So I had to show them some like neurological like studies and talks, and I was like, this is why I say we need to do more of this. So very interesting. How do you stay grounded, like yourself and your team, especially when you say a lot of folks reach out to you in crisis mode and there's a lot of stress on their side? In that type of situation, how do you stay grounded, stay focused to help them get through it and to get what needs to get done?
Yeah. Well, I feel like for us, that's almost the easy part, because, we are so well resourced that in that moment, when they come to us with this problem, we have solutions. And it is incredibly gratifying to help someone solve that problem. The other piece is back to, people need validation, support, to be heard. They need a partner in what they're experiencing, and just to be present with them on this little path. That's why I named my company Pathways, that I see us as just walking this path alongside this individual or this family. And there's lots of right ways to do things. The path could be going any direction, but we're walking alongside them to offer that support, and just being present with them sometimes can de-escalate things, because people, when they're in a crisis, they don't want to feel alone. And so I feel like that part isn't the difficult part. But I think I also, I loved hospice nursing. I've always loved being in community with people, even in their grief, or even in that crisis. I have always found it to be a tremendous honor to be able to be there with them. And I've been able to find a team who feels that way too.
Yeah. How do you stay detached though when they're pouring out all the crisis? And how do you stay detached, and how do you, instead of doing things for them, you're actually walking them through the things that they can do? And a lot of times there, you meet caregivers who say, let me just do it. It's easier for me to just do it. And so how do you, stay detached from all that, suffering, crisis, whatever they're going through, and actually walk them through all of it?
Yeah. So the strategy is a little different with every family that we're working with. Sometimes it's helping them organize it, kind of get it into kind of manageable steps.
Mm-hmm.
There are times, and I think some of the most challenging cases that our team works with is when people come to us. I'll provide the example, and it's often adult children or it's spouses that will come to us, and maybe their loved one has a problem with alcohol abuse. Mm-hmm. And even though their bodies and their brains are being negatively impacted by the alcohol abuse, the individual may be unwilling to stop drinking. And, when these families are watching their loved one deteriorate in front of them, and the only person that can change the trajectory is the individual, and they're choosing not to, I think those are some of the more difficult cases for our staff, to acknowledge that people have the right to make decisions that are not in their best interest. And how do we stay in community with someone and walk that path and deal with our own, whether it's judgment or sadness about watching it, but still be able to, kind of provide that presence and support in honoring somebody's choice and their right to make that decision. So I think protecting yourself, your peace, that self-care piece is what's grounding and what allows you to be present where people are experiencing trauma.
Yeah. It's a lot of big lessons, right? What have you learned from working with elderly? What life lessons have you learned helping so many families over the years?
Yeah, so I think the what was really impactful. I was a hospice nurse in my 20s. And, I worked with a lot of social workers who were much more experienced and much more mature. And I can remember as a 20-something nurse, writing in a chart, patient is non-compliant with the care plan, and these social workers took that phrase non-compliant out of my vocabulary. They really guided me and taught me how to meet someone where they are, and how, there's more than one right way to do things. And so I think that, working with older adults and hearing all of these life stories, our elders are often comfortable with a higher level of personal risk than their adult children. They've lived longer, they've survived more, their perspective is different. And where that really comes into play is trying to balance this idea of safety and quality of life. And how much risk do we take to support someone's quality of life and their personal autonomy, supporting that as much as possible. So, fall risk is a thing that we get into often. And kids are very worried about, mom or dad is going to fall. They're going to fall. And they might fall. But we don't wrap someone in bubble wrap and duct tape them to a chair so they don't fall, right? Like, where is the quality of life in that? And so trying to navigate that gray area, I think it is something that has been tremendously impactful to hear the stories, to get to know the person, what's important to them, and to really use that as the compass to guide the plan. And then I have all of this knowledge and all of this experience that I can kind of bring in. But the core of that has to be what the individual wants and needs and what's important to them. Otherwise, all of my ideas aren't very useful.
Yeah. So has your perspective on aging changed working with so many elderly patients over time? Yeah.
Yeah, of course. I mean, how could it not? I think that one of the things that really wasn't an emphasis in my nursing education and in a lot of my clinical experience, that I think that the most important piece of aging is a sense of purpose. The people who are most successful in their aging, physical debility aside, is a sense of purpose. And I think that's something we need to do better, especially in the way we manage aging
in the United States. We kind of have this idea of, oh, okay, so now you're going to, maybe you've been an engineer and a veteran and a spouse, and you coached basketball and you were in this leadership position in your church, but now you're going to go to assisted living and you're going to play bingo for the rest of your life.
Yeah.
And we act like that's a prize, and it's not. There's a tremendous amount of loss of identity and purpose that comes with aging. And I'm really interested, there's, of course, the Dementia Village in the Netherlands is such an interesting model for, they don't focus on these structured activities. What they have is a store on the campus, and people go and they choose what they're going to make. And then they go back and they have staff that help them to whatever their ability is, slice their vegetables. They let people with dementia have knives to cut a carrot because they've been cutting carrots for 50 and 60 years. And, it's very unlikely they're going to hurt anybody with a knife, but we don't let anybody in dementia care in the US. So there's this sense of purpose that is so critical. And I'm very interested in how to help older adults find that and retain it, because it makes such a huge difference in aging.
And how do they find it when people around them are saying, no, you cannot do this, you're getting old, you cannot remember, you cannot touch this? How does an elderly person actually navigate through all the no's around them and not get discouraged and continue to do what they love to do?
So you have to be really intentional about it. And I think the ways that we do that is a lot of educating the caregiver. The falls thing is a big thing that we run into, because there's this sense of, oh, if you let someone fall, it's neglect, and people who want to move should be able to move as safely as we can make it. Yeah. But even when they, hire 24-hour care, and we see families feeling pressured to do this while someone is in assisted living. So they're paying for assisted living and then paying for this 24/7 care because they're worried about a fall. And I don't support that. I mean, I feel like there's things that we can do to minimize the risk, but at the end of the day, we should allow people to move their bodies in purposeful ways. We have one woman we take care of who ran libraries. She just had a very accomplished career, but very busy, type A, in the office. She does have dementia and she is in memory care, but in her world, in her reality, she's in the office. And so we had to set her up with a tray on her walker with office supplies, because that needed to go with her everywhere. And she writes things on sticky notes and puts them in different places. But we had to figure out a way for her to retain that part. And there might be other activities happening, and maybe staff are saying, okay, no, we want you to go to this activity right now and do paint the picture or something like that. But that's not, we can offer her that, but she should have an alternative. And what she wants is her office supplies. And that's what gives her this sense of identity and this sense of purpose that feels important to her. And then she also bosses us all around and tells us to go get the boxes, and there's conferences coming, and we've got all of these things to do, and so we engage in those conversations with her. We step into her reality with her, because that helps reinforce this sense of purpose. So I think it looks a little different for every individual, and as people's cognitive abilities change, the way we can engage that looks different. Sometimes it's sensory. I worked with a gentleman who had spent his entire career with horses, taking care of horses, taking people out on riding tours with horses. And then, he was no longer able to safely ride a horse. And we put together a sensory box for him that had the feed, that had the hay and the grass and the smell of that, that had a grooming brush, that had, tools for him to handle. And when we do that correctly, we often see less reliance on medication to manage, agitation and frustration and things like that, when we can tap into that sense of purpose and identity.
Yeah. So with your practice, you're seeing mostly patients with dementia and Parkinson's?
So that's an area of expertise of mine. So we see a lot of folks. I would say probably about half of our clients have those diagnoses.
Okay. So is there, for families working with, they're just, I guess, the patient themselves and the families, do you also help with like the acceptance journey?
Oh, yes. I mean, it's, it's always, half and half of actually, providing the information, doing the coordination, all of those pieces that are tapping into our knowledge base. But it's also helping reassure families and care partners around what's happening, and sometimes for the individual also. But again, acceptance for that individual, that's their own personal thing. We're always talking about it, but we respect people's choices. But I think that, where the acceptance piece, we see families have a lot of guilt about using memory care for somebody, or, feeling guilty because their parents are wanting to age in place and they don't feel like it's safe and they can't get their parents to do what they want them to do. So it's, that's one of our kind of our core values that we've identified, that we, yes, we care for individuals, but care plans aren't just for individuals, they're for family systems and sometimes community systems, because people don't age in a vacuum. It's not just about one person. It impacts everybody in the system, and everybody's perspective and experience is different. So we really kind of in tandem have to make sure that individual's wishes and preferences and autonomy are honored, which means that, the family member who maybe doesn't support some of those choices has an opportunity to reframe how they're thinking and feeling about it. And then that kind of comes back into boundaries, So if mom wants to stay at home, which means that, she's falling all the time, and then she's calling you, and every night at 2:00 in the morning, she wants you to drive to the house and help her get up off the floor. Maybe that's not something you can do because it doesn't allow you to get enough rest. So maybe if mom wants to make this decision, then we're going to get her a fall alert, and she can push the button and 911 can come help her get off the floor. And if that becomes inconvenient for mom, then mom can make her own decision about what she wants to do. But you also have the right as the daughter to make sure that you're getting enough rest and you can care for yourself. So you can set a boundary if you and mom aren't on the same page about what care should look like. It doesn't all have to fall on your shoulders. And so that's that can be interesting, kind of helping, each individual within that system identify where their boundaries are and help families make a plan.
Yeah. So as we wrap up, tell our listeners how they can find more about your services. And, if you have any like last thoughts that you would like to convey. A lot of the listeners are patients or their caregivers, and most of them are elderly. So I would love to hear if you have any final thoughts, and of course, like Bob said, where they can find your information.
Well, as you mentioned before, a lot of people don't know about aging life care professionals. I think we're still the best kept secret in aging care, and I think we wish we weren't a secret, because I think we can help a lot of people. But my practice is called Pathways in Aging, and you can learn more about me on my website, pathwaysinaging.com.
And I'll link it with the video so people have access to it.
Thank you.
Yeah, thank you. Thank you so much for taking the time. I've learned so much myself. I've seen my mother-in-law lived with us, and we cared for her, especially towards the end. She had to be hospitalized and then put in hospice and all of that. And like you said, looking back, I'm like, maybe we should have looked into some of this sooner rather than kind of trying to navigate it all by ourselves. So there's so much information. And like I said, we have so many patients come in. Sometimes they don't have, caregivers with them. Even like we've seen some patients with dementia, they're driving by themselves coming to the office. Sometimes they get lost, and we're trying to navigate, and it's just trying to get them to advocate for themselves and have a caregiver present, or just talk to their primary care physician about what they're experiencing so they can actually get some help.
Yeah. I think too, there's the other benefit that somebody like us can bring is that, again, back to these fragmented resources, there's resources out there that are, that are covered by insurance or are low or no cost, things through the Area Agency on Aging. We've got the GUIDE program now funded by Medicare at 100% that provides $2,500 a year in respite care for people with dementia, as well as care coordination. And that's covered by Medicare. There's, mobile urgent care. I still can't believe how many people don't know about Dispatch Health. We tell people about Dispatch Health all of the time. Covered by Medicare, can help keep our elders out of the emergency room. So sometimes, for that, the cost of 1 hour of consultation, we can pour a lot of resources in to help people with successful aging that are more valuable than just call this company for a paid service. We know how all the pieces come together.
Yeah. Well, I'm glad you were able to take some time and talk to me about all the services you provide and how you've had a beautiful smile throughout, and I can visualize how even with your patients in the crisis mode, you're still carrying your smile, and that helps the person you're talking to kind of stay grounded and kind of be in the moment too. So I've really enjoyed our conversation.
Well, thank you so much for having me. I love this work. I feel like I'm exactly where I'm supposed to be, and fortunate to have found many other healthcare professionals who love it as much as I do. So
what a wealth of information, from estate planning to sibling dynamics. It's clear Heather's work is so much more than medical care. It's about supporting the whole family system. A huge thank you to Heather Suri for joining us today and sharing how she's built her practice centered in true advocacy. To my listeners, I hope this conversation helps you find a little bit more balance in your own lane today. We'll see you in the next episode. Thank you for watching.